This week's Ask Me Anything, I got a great question about why I don't believe in the validity or effectiveness of a chiropractic adjustment, even though I have my doctorate in chiropractic. What's up, everybody? Dr. Matt Badger here, creator of the Peak Method, founder of the Soft Tissue Revolution, where we teach massage therapists a new treatment method that focuses on working smarter, not harder, allowing them to make well over $100,000 per year with less than 20 hours of time per week in the clinic. So I get this question a lot. People are blown away by the idea that I went all the way through chiropractic school and I don't do any adjustments. And secondly, I don't even believe that they have any long-term effects on anything, and they're not even a treatment. So I had someone reach out the other day and really just dive into that question. They're like, I still go to the chiropractor and I think I feel better and it helps, but why are you so anti-adjustment if you spend all that time and money on getting a chiropractic degree? So I thought this would be a good chance to answer that. How I got to be this way. A lot of things happened, but I was about halfway through chiropractic school. We go for 10 trimesters. I was on my 6th trimester. And during that time, we really start talking about the theory and the idea of what's called the subluxation. And I was in a class once and the teacher was talking about the bone going out of place, causing all these issues, like a whole list of all these problems that are caused by this subluxation, and that our job as a chiropractor was to put the bone back in place. I have a little bit of a background in critical thinking and engineering. And I thought to myself, I go, well, doesn't the muscles and the ligaments and the tendons kind of hold the bone and the joint in place? Why don't we just fix that in the first place? I thought of the idea of like the bone is like the brick going out of place and the mortar is the soft tissue. So why not just fix the soft tissue so the bone holds and goes in place and you don't have to continue to do the adjustment? The teacher looked at me like my head was going to explode. They couldn't believe I would ask such a preposterous question. And the answer I got was a bunch of nonsense too. She looked right at me and she goes, "You know what, Matt, if you don't believe in the healing powers of chiropractic, you should probably just drop out of school because obviously this profession isn't for you." And I was like, maybe it isn't. So, I went back to my room, thought about it a little while, and I was like, shit, I've already spent about 80, 90 grand, got halfway through all this stuff, and I'm going to just drop out of school. Like, that sucks. So I started investigating more and more. And at this time, I was really getting into like anatomy and physiology and really understanding it more and more. And I started understanding that there were advanced soft tissue methods out there and soft tissue treatment could work. I ended up taking like every active release technique course you could think of. I did a lot of extra training. I spent a lot of time in the lab, just really dived into the muscles. And I was like, oh, this could actually be something that's really cool and you can fix the soft tissue. So there were people out there like me that are considered heretics in the profession, but we started to realize that, hey, if you fix the soft tissue, you don't really need to do the adjustment. So as I got better and better at soft tissue treatment, taking every seminar you can think of, when I got into clinic, I started getting more and more clients and more patients in the clinic than anyone else got. I even got like the head of departments and even like the dean of the school that came in to see me specifically for soft tissue treatment. I'm like, oh shit, I'm on to something. So soft tissue really is the way to go. And that's why I believe in it so much and don't do any adjustments. So I don't believe an adjustment is a treatment. I talk about this all the time. You break treatment into components and we want to be factual about it, not emotional. Like, hey, it works, I feel better, you got to believe in it. Like, that's nonsense. That's horseshit. That doesn't tell you anything. You have to look at it from 3 criteria. Is it safe? Is it effective? Is it durable? Does it meet those criteria? And honestly, chiropractic doesn't do that for me. Safe, yeah, for the most part, it's safe. There are some risk factors with like getting cervical manipulation with a stroke, but you're actually more likely to get struck by lightning and eaten by an alligator and ride on a unicorn. Effective. Well, does it temporarily make you feel better? Sure, it does make you feel better, but you also could pop an Advil or an ibuprofen and feel better as well. Now, durable. Is it durable? Is it long lasting in fixing the problem? And no, it doesn't fit that criteria for me at all. So I don't believe that chiropractic adjustments are treatment. They might be used as maintenance, but they're not an actual treatment. So I don't bother to do something that isn't an actual treatment, because at the end of the day, the client is coming into me to get a problem solved, and I have to give them the best tools and the best advice and the best functional based treatments that I can. Now, can an adjustment help? Sure. In acute low back pain, that's their like go-to study for chiropractors. Acute low back pain. Like, you can help with acute low back pain. You know what? Honestly, a lot of things can help with acute low back pain. And one of those things is actually time. Over time, it just gets better on its own and it starts to resolve. But what happens is people end up at the chiropractor as soon as they get acute low back pain. And over a couple of weeks, it does wash out. But they think that what the chiropractor did fixed it. But what really did fix it was just time and the body kind of healing itself up. So yeah, it can help with acute pain. But you know what? In all honesty, I don't like treating or evaluating acute pain people because they're desperate, they're short-sighted, they want to get in right away, they want it gone right away. I don't really mess with that. I tend to be more of a chronic type of pain where someone's been dealing with it for a while, at least 6 months, seen multiple practitioners, because they'll truly appreciate what we do. So I got this question and people reached out to me because there's a lot of massage therapists working in chiropractic offices, and they think it kind of goes in conjunction, hand in hand. And just having conversations with a lot of people, especially massage therapists, are like, most people just want to end up seeing me and they know the chiropractic doesn't really work, but they still have to go there anyway. And their clients feel bad because they just want the massage and the soft tissue work, but they have to go to the chiropractor. And in a lot of situations, it's actually making that situation worse. So the soft tissue is the key, and you don't actually need to do the adjustment. It's actually overkill, and sometimes it can make things a little worse because a lot of times the joints that are popping and cracking are the ones that are already moving too much, and the ones that need to move, they're stuck and they're not moving at all, and they're putting more pressure on the joint, the cartilage, the disc, all that kind of stuff in there. So I get this all the time, and I make these posts and I make these videos about don't be subservient to other practitioners. Just because someone has a doctorate doesn't mean jack shit. You know, I got my doctorate in chiropractic and it wasn't really that hard. You know, you just had to put the hours in and the time in and pass the boards. It wasn't that hard, but people live in this society. They're like, well, I'm a doctor and I'm smarter than you. It's like, no, you're not. It doesn't matter. At the end of the day, are you getting results? Because then you start to argue with these people, and there's nothing worse than arguing with somebody, especially as humans. We're built into this like innate biases. You know, one is confirmation bias. No matter what I do, I'm going to look at material and information to fit my mold. And the other one's conviction bias. You know, I believe in what I do so strongly that anyone else that like questions that or talks about that in a different way is a jerk. They're an asshole, all stuff like that. And that's happened to me a lot. I get a lot of hate from my own profession. I don't even consider myself a chiropractor. I don't even introduce myself as a chiropractor. I just say I'm a soft tissue specialist and this is what I do. I get a lot of hate from the chiropractors. I used to engage with them, but I don't anymore. I just delete their comments and move on with my day because it's not worth my time and energy to argue with someone that is so biased and doesn't want to see the other side. And whenever someone tells you this idea of like, you just have to believe, you have to believe, like that doesn't tell me shit. We're not believing, we're working in results. So another thing you must do is you must educate your clients about what's going on. And when they ask you questions, don't just be like, well, I guess you should see the chiropractor too. Ask them questions. Give them the analogies that I talked about, like your thumb, not your thumb, your bone is the brick, it goes out of place, and the soft tissue is the mortar. I'm fixing that so you don't actually need to be adjusted, and let the client start to connect the dots, but be there and be able to properly educate them on the idea that they don't need to be adjusted. They really just need to see the soft tissue practitioner, which hopefully is you. And then the next thing is work for yourself. Quit working for someone else. You can make more money. There's less nonsense. You can do the things you need to do. If you have really good skills and you're working for a chiropractor and you're getting paid a percentage, what are they really doing? Like they're taking money from you and you're making them look better. And it just puts you in a really bad spot. And lastly, and I say this all the time, there's no hack. There's no secret 10 steps to getting there. It's just time, intensity, and a focus to being the best at what you do. Get so damn good that they can't ignore you. And soft tissue treatment is something you must master and perfect. You're not going to learn it in one weekend seminar and think you're fucking amazing at it. It takes time, it takes dedication, but when you do it and you do it the best, you can go anywhere you want to be. You can make any money you want to make, and you will be recession-proof, inflation-proof, all that stuff, and you will be in a different place because you're so good They can't ignore you. So that's all I got. I appreciate the question. If you have any questions you want me to cover, send them in. Always happy to do these questions and help as best I can. Go grab our free training. I keep saying this all the time. Our free training is actually better than any paid course you would ever get. And if you think it's that great, then you might even want to come and learn directly with me and become that journey to become a true solutions provider and get so good they can't ignore you. Appreciate you guys, and I'll see you on the next one. Bye.